In a year dominated by coronavirus, it shouldn't take much to convince anyone that human health and the environment are connected. In a later video, we'll talk about viruses that move between animal and human populations, like the coronavirus. But in this video, I want to start first by laying the groundwork to understand what environmental health is and what it focuses on. In this video, we'll look at overall patterns for human mortality, basically asking the question, what do we die from? We'll look at how those patterns vary from poor to wealthy countries, and then we'll also look at how the causes of death have changed over the past decade. As a quick introduction, let's talk about what environmental health is. This is a subfield within the broader area of public health and epidemiology that is specifically focused on how the natural and built environment affects human health. For the purposes of this course, that includes many of the topics that we're going to talk about, including air pollution, water pollution, climate and health, diseases that are caused by toxins or hazardous chemicals, and all the viral, bacterial, and microbial diseases that move through human and animal populations. This list could go on, but the main point is that environmental health is critically important to questions of sustainability, as well as to a number of questions about equity, both within and across countries. This graph and the next few are from a very large study published in 2018 in the Lancet journal. The study is known as the Global Burden of Disease Study, and it's a comprehensive analysis of when and why we as human beings die. This graph is pretty complicated, but it's one of the few that can give us a snapshot of human mortality in a single image. To orient you to the image, the x-axis represents deaths, with the values on the right representing males and the values on the left representing females. The black line down the middle is the breakpoint. The y-axis has age, ranging from days at the bottom to 4-year increments as we move up after age 1. There are a lot of different causes of death represented here, so I broke them out into 4 colors with basic explanations. These are listed on the right, but in a broad sense, the red colors are infectious disease and a range of preventable causes of death that are more common in poor countries. The blue colors are cancers, cardiovascular disease, and other diseases that predominantly affect people in older age groups. Purple are neurological diseases, such as stroke, plus substance use, diabetes, and skin and musculoskeletal diseases or disorders. Lastly, green includes transport accidents and self-harm. You could spend a long time looking at this graph, so feel free to pause the video, but I want to highlight a couple of key points. The first is that the male curve is different from the female curve. Men tend to die earlier than women, and men tend to die at a higher rate due to trauma, the colors in green. In fact, in the United States, trauma is a leading killer of men under the age of 40. You can see in the graph that a lot of children die under the age of 5, with many dying under the age of 1. Most of these deaths occur in the poorest countries on the planet and are caused by preventable disease, such as waterborne diarrheal disease, and from nutritional deficiencies, which could be addressed through improved food supply. We'll talk more about this in later parts of the course. I mentioned at the beginning of this video that death rates vary considerably around the world. This graph shows total deaths due to violence, disasters, famine, and disease outbreak between 1980 and 2017. Some of these patterns may be similar to what you might expect, with lower totals in the wealthier countries and higher totals in developing economies, but you can see that there's a lot of variation around the world. What you didn't see in the prior map is how much things have changed over the last decade. This graph shows changes in mortality from 2007 to 2017 for some of the most important causes of death. Values below 0 are declines in mortality. These are examples of conditions that are getting better, that are improving, where mortality is declining. Values above 0 are increases in mortality. The orange colors show how much of the decline or increase is due to an actual change in the mortality of a particular cause and death. The dark green shows changes due to population growth in different parts of the world, and the light green shows changes that are a result of a population that is getting increasingly older on average. You have to correct for that if you want to estimate actual changes in disease burden. As we work our way down the list, we see major improvements in mortality due to HIV/AIDS, and this has had a particularly important effect on reducing mortality in many sub-Saharan African nations. There has been substantial improvement in death rates from a range of tropical and infectious diseases, and progress in reducing death due to preventable maternal or neonatal disorders related to health care, access to clean water, or access to adequate nutrition. The increase on this graph includes a range of different causes of death. Several of these are related to aging populations, such as cardiovascular disease or neurological disorders, which include stroke, but some of these are also environmentally related. For example, the chronic respiratory diseases can be caused by smoking, but can also be caused or exacerbated by chronic exposure to air pollution. The category called neoplasms here include cancers, and there are a number of cancers with possible or likely environmental links, particularly due to the exposure of certain chemicals and products or through other environmental transport pathways. I'm going to now show you a visualization of how life expectancy has changed from 1990 to 2015. This particular visualization is for males, and so life expectancy will be a couple to a few years shorter than it is for females. If you want to look at the visualization yourself, the link is at the bottom of the page. For reference, the darkest blue colors are around 80 years old, and the yellow colors are in the mid-40s to low 50s. The simulation will start in 1990, and at a period of time where there is a high incidence of HIV/AIDS, reducing life expectancies in a number of countries in sub-Saharan Africa. The year in each image in the simulation is shown at the bottom in green, and as time goes by, you see some significant changes in life expectancy. The biggest changes have occurred in sub-Saharan Africa and are the result of new antiretroviral treatments for HIV/AIDS, as well as improvements in maternal and child health. Despite these improvements, there remain persistent differences in life expectancies across the planet. To summarize what we've seen here, the environment influences many major causes of death for humans. In a broad sense, the highest rates of death are either in the young due to largely preventable causes, often in poor countries, or in the old due to a combination of disease and chronic conditions, many of which are related to lifestyle and nutrition, and some of which are related to the environment. There's a great deal of variation in the rates of death and the causes of death across the planet, but there has been a significant improvement in life expectancy and a reduction in preventable death in the past 20 years. In the next videos, we'll dig into some of the specific important areas within environmental health, particularly as we continue to struggle with the COVID-19 outbreak, which is the topic of the next video.